Well, hello and welcome to Heart Procedures. We're going to talk about some procedures that they do mainly in hospitals for patients with cardiac illnesses. The first one is CABG surgery. This one facilitates blood flow to the heart. For this, they will use an internal memory artery, saphenous vein, or radial artery. Arteries have longer patency. When is CABG done? Who qualifies for this? Patients who have an AMI or heart attack, unstable angina, blockage of the left main artery, or have failure or percutaneous interventions. A traditional CABG is done this way. They do a median sternotomy, so they open up the sternum, they cut out the pericardium, they try to preserve the myocardial muscle, and they do a cardiopulmonary bypass. What are some risks associated with CABG? Well, there's an increased chance of death with congestive heart failure and low ejection fraction. A normal ejection fraction is 65% or above. Anything under could indicate heart failure. Other risks associated with CABG are left ventricle dysfunction. Age is a risk factor for a CABG surgery. Sex, being a female, and also having a number of diseased vessels. With the traditional CABG, they do grafts, they wean the bypass, they defibrillate if needed, they add mediastinal and chest tubes, so mediastinal tubes and chest tubes. They place epicardial pacing wires, and they wire the sternum. Complications of CABG would be pain, infection, it might not work, dysrhythmia, death, respiratory insufficiency, emboli that can lead to a stroke, low cardiac output, myocardial infarction during the procedure, impaired contractility, or pericardial tamponade. There's another kind of procedure that is minimally invasive called minimally invasive direct coronary artery bypass surgery. This is not a cardiopulmonary bypass. The heart still beats while they do this procedure, and they do one or two bypasses. Cardiac surgery, of course, always could have complications such as low cardiac output, mediastinal bleeding, atrial dysrhythmias, and hypovolemia. With mediastinal bleeding, infection is very serious if external, like a sternum gets infected. With low cardiac output, there can be renal impairment because remember the kidneys like to stay wet. There can be gastrointestinal dysfunction. There's not enough blood going to the GI system. And impaired peripheral circulation. After surgery, we have to, of course, check on the patient, monitor their neurological function, cardiac system, respiratory system, fluid and electrolytes, assess their pain, assess their renal function, if they're bleeding, and also check their peripheral vascular status. And this is the end of this cardiac section part 2.